Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. Now, osteoarthritis, or OA, is the most common form of arthritis, and the knee is one of the most affected joints. Now, OA of the knee is chronic, degenerative, which means it's never going to go away, and it's going to get worse over time. Now, according to a new survey, all patients have tried some form of treatment to address their pain. However, 97% still report that their daily lives are negatively impacted by their condition. Dr. Brian Carr, an orthopedic surgeon, is joining us live from Las Vegas to talk about this new survey and to share his non-opioid approach to manage the pain. Welcome to Health Professional Radio, Dr. Brian Carr. Thank you for taking the time.
Thanks for having me.
What trends are you seeing in patients suffering from osteoarthritis?
Several. Osteoarthritis is very common, and more patients are approaching healthcare professionals to help them address the pain. We do several 100,000 knee replacements a year as a result of osteoarthritis, and knee pain is miserable, and we need to find better ways to deal with it.
Are there tests to determine whether or not a person is suffering from OA, the beginnings of OA, or some other type of knee pain for some other type of injury?
The most common test we use to differentiate the types of arthritis or knee pain is a plain X-ray. And when the patients are standing and we get an X-ray, we can tell how much of the cartilage is lost. And we've all heard about that bone-on-bone appearance on X-rays. That indicates that most of the cartilage is gone, and very common in osteoarthritis.
Now, is this something that can affect younger adults?
It can certainly affect younger people. In fact, we're seeing patients younger and younger because knee pain can be quite difficult to deal with, and so we're seeing them younger and younger each year. We generally try and reserve knee replacement surgery for the older adults because we know that they don't last forever. It's a big surgery that we think lasts about 20 years, and if you're younger, you want to use any non-operative technique you can to delay that big surgery.
So how does chronic knee pain or osteoarthritis impact people's daily lives? We said that 97% of people still say that their life is impacted negatively.
It impacts their ability to do things they like play tennis or golf or run, or exercise in general. It impacts them socially. They don't go out as much. It impacts their work. They can't work as well. When the arthritis is severe and there's deformity associated with it, they just can't physically do the things that they used to be able to do. And it could be quite miserable. And then the options to treat that, especially surgery, are terrifying. And if there's a way to help deal with the pain or help delay surgery or make this process to treat them less miserable, that's what we try to do.
So what have patients with this knee condition traditionally used to manage their pain, and what treatment options are currently available?
So typically people, they reduce their activities that aggravate their symptoms. They take anti-inflammatory medications like ibuprofen or naproxen, and those medications long-term can have some negative health side effects. Some patients are even using occasional narcotic medications to manage their knee pain, which is a very challenging thing because of our narcotic epidemic in the U.S. and not safe. People use, exercise, physical therapy, and even surgery.
You have a non-opioid approach. How is it different from these other go-tos that you've been talking about?
And so iovera is a product that not only is it non-opioid, but it's non-medicine. There's no medicine really involved in this procedure. We use an ultrasound device, and we're able to identify some of the superficial nerves in the front part of the knee where most of the knee pain is generated. And the device will allow us to freeze those nerves, and that will stop the pain signals for about 3 to 4 months. And that is a medicine-free and excellent pain solution.
There is a lot less pain involved, or no pain, in this chronically degenerative disease. Does there exist the possibility of knee function just ceasing, even though there's a lack of pain? Your knees just won't bend anymore because the bone isn't going to regenerate.
Correct. That's an excellent question. In fact, when I first started using this product, the patients were doing so well that I tried to really slow them down because they couldn't feel it anymore when it was swelling, and I didn't want them to have too much swelling after surgery. And but I tell them, if the knee pain is bad and the deformity is bad, there are mechanical problems in the knee that can still make it stiff and not function appropriately, but it just doesn't hurt as bad.
Is there any information as far as the long-term use?
There are a few things that we look out for. There are complications that could be associated with it, but they're very rare. I haven't even seen them in my practice, but we are placing in, small needles in and around the skin. So some people have scabbing and that sort of thing. But the iovera device works at a temperature that doesn't permanently damage the nerves. And so we know what temperature that is. We've tested that in research. It's about minus 90 degrees Celsius. And so it's cold enough to make the nerves stop working for about 3 to 4 months, but it's not cold enough to permanently damage them. And so I'm unaware of any long-term complications from it yet, but I have had several patients in my practice where every 3 to 4 months they want to refreeze their nerves.
Is every person suffering with OA, specifically knee problems, a good candidate for this device, or are there certain criteria that would eliminate a person from using this device successfully?
The indication for this procedure is knee pain. So theoretically, you could use it for anyone suffering knee pain. I try, if it's knee pain from arthritis, I think it's an excellent option. If it's knee pain from other things like a meniscus tear or inflammation in the knee, we always try and treat the root cause of the pain before offering this treatment. That would just cover it up.
Is there anything that you'd like to add for our listeners? And then give us a website where our listeners can learn more.
Sure. I think the most important part of this, and the reason why I'm so passionate about it, is that knee pain, and especially surgery around it, can be quite miserable, and it just doesn't have to be. The patients that go through this, they leave the hospital sooner. 95+% of my patients go home same day after knee replacement without pain. And I've never heard of that in my career. They always have some sort of discomfort and pain. It's the biggest operation we do in the knee, and that's what really impressed me, is how well they were functioning, and they were finishing their PT in 2 weeks instead of 12 weeks, those kind of things that I saw in my patients. The best place to find information on this moving forward, and I'm happy to talk to anyone, is iovera.com.
Well, Dr. Carr, it's been a pleasure. Thank you so much.
Likewise, Neil. Thanks.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Brian Carr. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.